Hello, my name is Emily Marble. I'm a student at Frontier Nursing University. My formal paper was on the relationship between depression and the risk of substance use in adolescents. Substance use and depression occur concurrently in young people. It can be a very difficult situation for individuals, families, and healthcare treatment teams. Mental health problems and substance use are linked in a complicated correlation, and understanding this relationship is critical to implementing viable long-term solutions to assist youth with these healthcare issues. As an overview of my paper, um, studies in the past have been conflicting as far as the relationship between depression and substance use. They've attempted to determine if substance use is caused by depression or if depression makes young people more likely to initiate substance use. However, a recent study regarding this relationship shows that substance use and depression are bidirectional, meaning that both of these pathways seem to be active in the relationship. Negative urgency and internalizing symptoms have been linked to new initiation of substance use in adolescents, and screening for these may be helpful in identifying adolescents at risk for substance use. I'll go into what negative urgency and internalizing symptoms are in a few slides. So this bidirectional relationship is a two-way street. Substance use in adolescents worsens depressive symptoms, and depressive symptoms correlate to increase in substance use. According to the CCSA, which is the Canadian Substance Abuse Center, depression symptoms showed an increase in time over with the likelihood of starting new substance use. In the study by Stepinski et al., it showed that teenagers with depression were 40% more likely to begin using cannabis for the first time than adolescents without depression. This seems to indicate that adolescents who are struggling with depression symptoms may begin using substances in an effort to self-medicate themselves to alleviate their symptoms. In contrast with the substance use as a form of self-medication in adolescents, the same study showed an increase over time in depressive symptoms among individuals who use substances. Men and women who smoked tobacco experienced increases in symptoms of depression over time, with females having the strongest connection in this increase in depression levels. This finding shows that substance use is ineffective in treating depression, and that substance use makes underlying depression worse despite the adolescent's attempt to alleviate depression symptoms. Also create difficulties in adolescents' family and social dynamics that can contribute to depression or other mental health problems. Young people may experience adverse interactions with law enforcement as a result of substance use, which may increase negative feelings or emotions. Some contributing elements to new onset of substance use in adolescents with depression are negative urgency and internalizing symptoms. Negative urgency is the tendency to make rash choices during an emotional state as a mechanism to new initiation of substance use in adolescents with the feelings involved in depression can accumulate to influence adolescents to act without thinking ahead about the potential consequences of their actions. This emotional vulnerability makes it more likely that an adolescent will experiment with various substances, especially at an early age. The age that an adolescent begins using alcohol or marijuana has a significant adverse impact on long-term outcomes. And as a result, these findings indicate that it's critical to treat adolescents for depressive symptoms before they begin experimenting with substances as a result of negative urgency. Internalizing symptoms are symptoms of emotional distress that are focused inward as opposed to being expressed outwardly. And these kinds of symptoms have been linked to the new onset of cannabis use in adolescents. Adolescents who are experiencing internalizing symptoms are at greater risk because they may attempt to self-medicate their internal distress with cannabis or other substances as an attempt to cope with a negative affect. Adolescents who use substances such as cannabis in this study had higher rates of panic and depression symptoms They felt less connected to their educational communities, and they were more likely to have used other substances, including alcohol. This confirms those findings by Wilkinson et al. In that study that proposes that substances experience an increase in depression symptoms. In conclusion, these studies suggest that substance use prevention tactics should include screening all adolescents for depression and internalizing symptoms, as these are significant risk factors that with a greater likelihood of using substances, such as cannabis and alcohol. Here's my reference page. Thank you so much for your time.